Disasters can take many different forms. They can claim lives and destroy property. They can shake your sense of security and disrupt your quality of life. And ultimately, the ripples from a disaster can affect your mental health. Living through a disaster can be challenging in distinct ways over time. Remember that you may react differently than others, depending on many factors, including the intensity of the disaster, how you were affected, and how much social support you have. Even the same person can experience a combination of negative reactions, like feeling sad, frightened, or numb, and positive reactions, like feeling alert, inspired, and ready to help others. Just know this: stress reactions after disasters are very common and understandable. Be kind and patient with yourself and others as you navigate through the aftermath. What can help you get through it? There are steps you can take to find your footing again and reduce the effects of a disaster on your mental health. Start by focusing on one or more of these 5 essential elements of well-being: safety, calm, connection, self-efficacy, and hope. They can help you get through challenging situations. Choose the ones that work best for you in your life. Safety. Find ways to increase your sense of safety. Actively seek information that helps you feel safe. And don't hesitate to ask for help from others. Do your best to focus on small things that you can control from moment to moment. Calm. Find ways to calm yourself. Give yourself time to adjust to what has happened. Find ways to calm your mind and body. Try limiting your exposure to the news, particularly before bed. Connection. Connect with others. There are many ways to build and strengthen your connections. Spend time with the people most important to you, or those who are kind or understanding. Reach out and let loved ones know you care. Lend a hand to others. Find ways to share your feelings or ask for help. Self-efficacy. Believe that you can learn from and overcome challenges. Remember other times that you've done this. Seek out information to help you make decisions. You can learn from others who have faced similar situations. Focus on taking small steps each day. Prioritize what is possible and practical. Hope. Build your sense of hope, purpose, and meaning. Draw on your values, experiences, or faith. Notice how people come together to get through difficult times. Honor losses and find ways to make meaning of what has happened. Remain open to gradual progress and growth over time. In the weeks, months, and years after a disaster, focusing on these 5 elements of well-being: safety, calm, connection, self-efficacy, and hope can help you move forward and feel better. Intense feelings do tend to fade with time, but some people can continue to experience reactions such as anxiety, sadness, and anger. If you find that you are not feeling better after a month or so, are having a hard time functioning, or are suffering more than you can handle on your own, consider seeking help or guidance from mentors or professionals. If you develop anxiety, depression, post-traumatic stress disorder, also known as PTSD, or substance use problems, there are proven treatments that work. These treatments can help you talk through what has happened, feel supported, change your perspective on the event, and ultimately, move forward. Remember, you are not alone. Finding the right support can help you feel better. Use the QR code on the screen or type ptsd.va.gov into your browser to find more information and resources on disasters and mental health. This video was brought to you by the Department of Veterans Affairs.